Hi guys, it's Marcin here and
Hi, Neringa is here.
so we met with Neringa today in order to present you our therapies. We are both therapists, but from different countries as for origin and operating into different countries. So Neringa is in almost tropical area, which could be a paradise, which is?
It's in Spain, Canary Island, Tenerife.
Oh, and I'm from London, which is a little bit more rainy. So, Neringa, could you please tell us who you are, something more about you, your therapies,
Okay. So I'm Neringa, and I am professional therapist. I am the owner of Dragonfly Therapies, and I specialize in, I work overall in mental wellness, but also taking care of emotional, mental, and physical, all in one bunch. So what brought me to this? My own life experience and a great passion for helping people get better, because what I've gone through, it made me stronger. So I want to give to people, I want to give to communities my passion and my understanding. My background. I've studied in United States, have a bachelor's degree in management, and about 20 years of customer service experience. But throughout those 20 years, I also gained a lot of experience within the mental wellness and physical wellness. So I started my business, and I'm offering different therapies according to the client needs. Some of the therapies has to do with mental wellness, which would be reflective therapy, which is
what is reflective therapy? I have heard the name, but could you elaborate what does it mean actually? What do you do?
It's actually a unique approach to mental wellness, and it aids with a stress relief and mental clarity and emotional stability and relaxation on physical level. So we're working with people that have different problems. It's from whether it's relationships or the death or the substance abuse. I also do Indian head massage, which is another helpful therapy. It's an ancient therapy that can assist with reducing muscular and nervous system tension and detoxify the body and bring into homeostasis. Besides that, I'm working with quantum healing techniques. It's a very interesting technique that also help people that come and have problems with the with the illnesses, with the diseases. We're working on
what kind of disease? I'm sorry, what kind of diseases? Because maybe some people can be interested in what kind of disease or disorder or mental thing can you heal with using quantum healing?
Okay, well, you see what it is, what happens. Okay, so quantum healing, we work with diseases, it could be like fibromyalgia, right? Which is some people suffering from it for years. So when we go and we look into the toxins and pathogens, and why the body is not healing. Sometimes body cannot heal from things like receiving vaccination, which is injection in the body, and body can be affected. It can block the healing. So we go and we find the issues. It could be what person's diet, something that really affects, or it can be advanced trauma, which is going back to the past, to the childhood or even adulthood, and see where are the blocks, emotional, mental, and physical.
So you are looking for the source and following the rule that everything starts from energy and later on it manifests in, let's say, material world, which is the physical body. Yeah,
Yes.
this kind of stuff. Okay.
Yes, yes. And another thing that I also offer, I am official distributor, but also I personally use the Biomat.
What is that?
Okay, so it's a medical healing device. It's approved by FDA, and also it's also approved in Europe. It's medical healing device, which is it's a mat made of amethyst rocks, and what it does, it emanates infrared rays, negative ions, and amethyst rock itself, crystal itself, has a healing powers. So it is very helpful. It may help with a lot of things. It reduces inflammation and improves blood circulation and relaxes muscles. It gives temporary relief from pain. If you have a headaches, you cannot sleep, it helps. It has a lot of benefits. Why I came to and believe in this product, about a couple of years ago, I had a bicycle accident, and actually I had that mat at home, and I started using, and it dramatically helped me just to wake up in the morning and be able to walk. So I really believe in this product, and I'm very excited to offer that to my clients, and and I'm teaching people on what it is.
I see. So the mat with the crystals that you are lying on, it's a heated one, I suppose.
Yes.
Yeah, and this, it's like crystals. We know it's a healing effect.
Yes. What it does, it relaxes the muscles, because people these days very stressed out, and their muscles, they contracted and they stay in that position, so it really helps to relax. And what it does, it puts the body in homeostasis. It makes
balance.
Yes, it makes it balance. Yes.
Okay, so it can be for calming down, it can be for, as far as I presume, of course, it can be for the central nervous system. It's to make it calmer. Yeah, this kind of thing.
Yes, definitely. Also, what I want to mention about myself, my passion for people and really helping people, my plan is in the future to do workshops and just work with the people with different needs and on different levels. And I'm like very excited. I'm really looking forward to that.
Okay, so are you preparing any courses in the future for people?
Yes, I am working on the mindfulness course. And in the future, I will be offering workshops and doing mentoring and coaching, like life coaching.
Okay, fine. So but now so you will be offering also, apart from private client guidance, also like classes, yes? Because if you are preparing a course, it means that you will have some students, yeah? Okay.
Yes. And also what I want to mention, the practices, the sessions that I offer, my goal was to reach as many people as possible. Therefore, some of the sessions, some of the things that I offer can be offered only in person, but some things I also, like reflective therapy and quantum healing, I'm doing it online, so I can reach the audience. I can reach the people that need help just about anywhere in the world.
So potentially I could have been your patient, as for Zoom or Skype or Messenger or this kind of internet connection, because the energy, the physical distance is of no importance. more important here is to see you and the passage of energy. Okay,
Yes,
transfer
yes.
of energy.
And so I'm just really looking forward, meeting more people and, helping people and communities, really.
So where they can find you?
They can find me on a Facebook and Instagram, and maybe we can later on just post that.
Yeah, there will be the link below
Yeah.
the movie. Yeah.
Yes, and just
Fine.
simply on WhatsApp. These days we have so much technology that we can, with the easy access to it.
Exactly.
So listen. So enough about me. I really would like to know, Marcin, who are you? And I want to know more about you. So how about if we start? Who are you, Marcin?
I'm myself, I'm Marcin. So my name is Marcin Dominiak. So guys, so who I am, I'm also the therapist. The therapy for me, it's like a general term, and I can always, because I was ill as a child, and I had some problems with central nervous system, with emotions, with a lot of things, and with walking as well. I was not even able to walk for almost a year. So based on my experience, and I don't like, okay, there is a term which means alternative therapies, but I prefer the term complementary therapies, which are always going with the conventional medicine together. So we can do simultaneously follow the recommendations of the doctor, and at the same time, on top of that, add something that to make your treatment the most effective possible. So following this, I am a massage therapist. I have for now the highest UK qualification, which is sports massage therapy level 5.
Wow.
So it allows me to treat different issues like lower cross syndrome, upper cross syndrome, golfer's elbow or tennis elbow, different stuff. So this is about the physicality. So I have, so I can, if someone comes, because I have my clients in London, in Acton, if someone is coming here, so it's like a physical place where I can treat them, but and this needs to be physically done, of course. But also what I do is the mixture, it's so-called anti-stress therapy, which is a unique combination between the chair massage and table massage. So when people are sitting on a chair, they are leaning forward a little bit. They do so-called protractions. So their scapulas are going forward, and I can go deeper and work on meridians, work on some acupressure points, use some shiatsu techniques. So all together, so the chair one is for the upper body, and the table is for the lower back and lower extremities. So we have all together here. But because this is a physicality massage, and also people don't pay attention to this, but the muscles are getting constructed or constrained because of stress, and stress equals energy. Energy equals thoughts and emotions. So I am also a bioenergy therapist. So in this, I was qualified in Poland, and I have the master degree on this, which means that I can do my own therapy combined. So I've been a bioenergy therapist for almost 10 years now. And what I can see is that the most important thing that people have some problems is the past, and some traumas that we experience, all these things. So bioenergy is about the cleansing of personal energy space, is the diagnose of the quality. It's also the work on people's mind's frequencies, the alpha, theta, and delta states, that they are more preferable to the beta ones, which are the ones that we have on everyday life. So when we check, and it is also a guided visualization slash meditation. So during a session, I can show someone that they can also at their home do something. So try to teach them how to meditate. And we know that the meditation, it's also about the proper frequencies of our mind.
Yes.
So it's about the perception, yeah, because if I am in beta state and I see something as a tree, it can make me anger. And if I'm in theta state or delta state, I can see the tree and I can read aura of the tree. Yeah? It's still the same tree, but the perception is totally different based on this. So I'm trying to show people how differently they can perceive the same thing. The same rule applies to the some events from the past. So we can analyze it over the time, or we can forgive and move forward. It's all about our approach. So this is the bioenergy therapy. I have also some bioenergy charts, and I can with the pendulum verify different things. And there is also the Bovis scale that I can check different things here. So the Bovis chart is about the frequencies of water, of food, or different elements that we eat, and how this later on resonates with our health. Basically, whether it's putting our vibration higher or lower. And as the vibration or frequency change, therefore later on, as a consequence, we have a better or worse state of health. So this is bioenergy and massage.
And you know what? I really like what you do, because to me, it's like you taking care of everything, right? It's physical body and mental body and emotional and the energy, because I believe everything is connected. And for me, it's like, it sounds really, really, really good. I wanted to ask you, you also do something, you have a product, it's called Zinzino, or how you pronounce it?
Yeah, that's the name of the product.
Can you tell us about it?
Actually, these are the oils, yeah? So these are the, maybe I can show you one. I have actually one here, but I have more of them. But the basic thing is, so you can see Zinzino Premium Oil is here, and this is, okay, so this is a test-based nutrition thing. So these are the natural supplements, and actually it's about, because many people who are coming as a clients to visit me, and I was trying to help them, I was also looking for help them on some maybe semi-medical, maybe a little bit more physical level. Apart from massage, which is diet, but I know that many people have problems with following diet recommendations. And here we have supplements. So of course, we need to still pay attention to what we eat, but this can be, okay, so here we are talking about inflammatory and pro-inflammatory and anti-inflammatory factors. So omega fatty acids, omega-6s, which are pretty in everything that we are eating, they are pro-inflammatory in general, and anti-inflammatory are omega-3s, which of course, you know, fish oil, algae, etc., etc. But here we have the oil within which we have so-called polyphenols, and they are stabilizing the active omega-3s, so they act longer than the, in comparison to the average, several times longer than the average fish oil, or it's actually a blend with the oils, polyphenols, vitamin D, E, and some other things, which are really all of them are natural. So this is really helpful. And this test-based nutrition is also based on the test like this. It's like Zinzino balance test. So this test is performed by independent laboratory Vites in Norway, in Oslo, which basically shows us the ratio between omega-6s and omega-3s. But on top of that, it shows the level of 11 fatty acids that we have in our blood. So it can be like arachidonic acids, so responsible for the general inflammation state. It can be also the fluidity of the cell. The fluidity of the cell is very important, because if you know, people don't pay attention to cell. Cell is the smallest particle in our body, and everything starts from cell, isn't it?
Yes.
So once our membrane is fluid, the phytonutrients can come in and the toxins can easily come out. So if the fluidity of the cell's membrane is proper, there is go with the flow, like, with the cash flow.
Yes.
It's flowing and we can absorb more from our diet. So
can you Can you just can you tell us, so how does the test works? How they, they can get the test and what they need to do?
Thank you. So it is a test-based, self-performed test.
Okay.
So very easy. You can just drop several droplets of your blood on the paper. You just send it with recorded letter to Oslo. Within 2 weeks, you have results, and there is also an analysis and some dietary recommendations following
which is perfect. I like that. That they can do it themselves. They don't have to go anywhere, make any appointments, and also that it comes with recommendations, which that's what people need to know, what exactly they would need to do after that, isn't it?
Exactly. These are dietary recommendations. If someone is coming here for bioenergy, as a home care advisor, I'll tell them, okay, guys, please try this or that. If they come here for massage, okay, I can recommend this stretch or that stretch. Yes. And what about you? I think with your, for instance, reflective therapy, you do the same, don't you? I mean, you don't leave the client with the end of the session, but you still give some recommendations, aren't you?
Yes, we usually don't give like advice because in this case, someone comes with a mental, emotional issues. We just try to empower them by making themselves, we ask questions and persons start answering themselves, thinking and answering themselves,
reflecting.
But we obviously, we hold the confidentiality, and we just hold them space. And what it does when the client speaks, we reflect on everything, what they hear, what they say, we look how they act, so and yes, after they leave, we just not just leave them hanging and okay, we just gently, let's say, guiding them into their own understanding of what steps need to be taken to solve the issue, to make their lives better.
Exactly, because as the name itself indicates, reflective therapy, as far as I know, it's like to make them reflect.
Yes.
So think, double check, yeah. So think twice about what wrong they do and what should be the better response. Yeah. That's the thing.
Yes. So I wanted to ask you something else. So because you're doing so many things and everything, so can you tell me, is there something else, like you mentioned before something, do you have courses or what else is going on?
Yeah, so actually I'm preparing the course for the massage and for bioenergy therapy, and especially now it's like I would like to show people how do they do it. So it's gonna be the bioenergy course and massage course, and they will have this diploma level 3 afterwards. So I would like to show people because here, if I'm doing a session 1-to-1, it's fine, but if it's like for a larger group of people, it's just to show them that they can do it themselves. So I pay a lot of attention to the practical part.
Yes.
So it's not me doing for them, but it's teaching them how to do it themselves. That's the idea. So we'll be starting in spring, so everyone is invited. Of course, I will give the details below the movie. I mean below the video. Yeah. So what about your courses? You are starting when? Maybe it's under preparation.
I don't have a date yet, but it's definitely coming. Next year. I'll try to do my best because I feel these days, with so much stress and so much unknown in this world, we could really do help a lot of people with the courses.
Okay, great. So courses coming back with Neringa, courses coming back with Marcin. As you see, guys, we are in 2 different countries, but in January, Neringa will be coming to London, yeah?
Yes.
Possibly.
Yes.
And there will be an opportunity to have a session on the Biomat.
Yes.
So
And
if anyone would be interested, please, guys, let us know in the commentaries, or we'll give our details. And maybe it's even better to call Neringa if you would like to arrange an appointment or something like that. Yep. So we are very open. As you can see, we are both therapists. We are doing totally different things, but at the same time, we are doing very similar things.
yes,
So we are going on the top of the mountain, but using different trails. But still the mountain is the same.
yes, yes, I agree.
Great. So it was very nice to speak to you, Neringa, today.
Yes,
Thanks
it's
for that.
really, really great seeing you, and thank you for, you know, sharing who you are and giving us your information. Was really, really great to hear that.
And vice versa.
Okay.
Guys, thank you very much, and Merry Christmas and Happy New Year.
And we'll see you soon, guys.
See you soon, guys. Bye-bye.